You're watching the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering liposuction or any type of body contouring procedure. With us, we have cosmetic dermatologist, Dr. Barry Lycka. Dr. Lycka, welcome to the program.
Thank you for having me today. I'm really delighted to be here.
So before we get into today's topic, tell us a little bit about your practice as a cosmetic dermatologist. What are the different procedures you do, and who's the typical patient?
You know, Randy, I don't think we have a real typical patient. I see people from birth to grave. And in the very young people, we do things like port wine stains. You know what a port wine stain is?
I think I do, yes.
It's one of those big purple things on people's faces, and they just look terrible. And these kids come in, and they're just crying like crazy, and we make those port wine stains go away, and the patient is really, really happy, and the parents are really happy. Okay. We've changed a life there. But then, you know, in the teenage years, kids have acne, and they have real bad acne, and we really take care of that and make it better. And those that don't get better, we work at them until they get better.
But you're not your typical medical dermatologist like we call here in the States. I mean, you are using the newest laser technology. Is that correct?
Exactly, and we do a lot of lasers. We do the most modern lasers, and we do the most modern technology. But I think the thing that really makes me happy, the thing that I do the most of, is liposuction. It's one of those skills that I started way back when in my residency, and I kept on going.
Is this true? You were one of the first guys in Canada to do tumescent lipo, or maybe the first person?
You know, I think I was. I was one of the first guys. I jumped on it. It was one of those things
when
I first, you know, I remember the first time I saw a liposuction case. It was back in 1986. It was in my residency, in my first year of residency, and I said, I'm never going to do this because the results were horrendous. The person ended up in the intensive care unit. It took 3 weeks to recover, and I said, gosh, how can you do a procedure that's cosmetic and almost kill a person?
Okay.
And I said, there's no way I'm ever going to do this procedure. It's terrible. You know, and then in 1989, everything changed. We learned a means of doing it under local anesthesia called tumescent anesthesia.
Okay.
And that really opened the door for me. It really changed things completely. It made things so much better for people. I couldn't believe it. People would walk in for the procedure. They'd walk out after. The results were amazing, and I couldn't believe it. There's a lot of people that do liposuction, but to do it well is a whole different thing.
Well, and you like liposuction. You know, one of the things I shared with you.
No, Randy, I really don't like liposuction. I love liposuction.
You love it, okay.
It's one of those things that I do every day.
Most guys don't like doing it.
You know, I wake up in the morning and I salivate over it. And the night before, I could hardly go to bed thinking about this beautiful body I'm going to create.
You do like liposuction that much?
Oh, it's the most amazing thing.
Why though? Is it because of the results? It's one of those predictable procedures of all cosmetic procedures?
You know, it's everything about it. You've got to pay attention to the details in liposuction. That's what really differentiates it from everything else. It's one of those procedures that I really have a knack for. It's something that I pay attention to the details, and it's something that I just love doing. It's like a violinist playing a violin and bringing out the notes in it. You know, if you asked me what was my best case, I'd tell you it was my last case because every case I learned something from. Every time I bring something new to the table, but it's paying attention to those fine details.
Are you probably the busiest guy in Canada? I asked you on the phone, and you said you've been doing 200 to 300 liposuction procedures a year since 1994. Is that accurate?
Absolutely. I've done a lot of liposuction. It's something I really call happy medicine.
Do people know you out there? Or in Canada?
Humbly, I have a reputation. I have people coming to me from around the world. I have people coming from Europe. I have people coming from South America. I have people coming from the United States to see me in a little town called Edmonton, which most people haven't heard of. But it really is where people come to get good liposuction done.
Now, we've talked on the phone and in the green room. You say that the results are so much better now than they were when you first started doing this. How so? I mean, what's changed? Well, and it's safer, you say.
Let me tell you what's changed is that we don't really do liposuction anymore. We do liposculpture. The body is really being sculptured now. We've learned the fine points of changing this procedure from a pretty gross physical procedure to something where we're really sculpturing a body. We're bringing out the best in that body. You know, when an Eskimo does a carving from a piece of soapstone, what he does is bring out the spirit in that soapstone. That's what we're doing in liposuction.
Really?
We're taking a body and we're literally bringing out the body from underneath all that fat. We're taking that fat away.
The technology's changed. It allows you to grab the fat better. Is that right?
It's not only grab the fat better, we can really sculpture it. We can remove it. We can remove it very finely.
But what
we
is
can
that
literally
technology?
Sculpture things. It is a fine art. It's not only a science, it's an art. It's an art form that we're doing now, something that's totally different than before. We're really taking a body using very, very fine cannulas, very, very fine tubes, and literally sculpting the area. But we're also using lasers to sculpture that area to get little bits of fat that we couldn't get before. We're using ultrasound to take little bits of fat and take them out.
What does the ultrasound do, by the way?
Well, before we do any suctioning, we actually do ultrasound to that area. Because what the ultrasound does is the ultrasound causes the cells to swell a little bit, so we can target them that much better. The cells literally pop. And when we touch them with the laser, you can hear this pop, 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 pop. And it's amazing because those, just like bubble wrap, the fat is going away. And then we use a very, very fine cannula to evacuate it. We're literally sculpturing the body. We're literally letting the muscles shine through, things that we couldn't do before. But you know, even more than that, even more than what we're doing physically, is something that I can't believe. And that is what happens to a person. They start to work out more. They start to change.
So you
they
say,
start to see the difference.
It's more than just lipo. We're transforming lives.
We are transforming lives. This is really what I call happy medicine. People change. They start eating better. They start doing better. You know the old joke of not eating the chocolate cake, just rub it on your tummy because that's where it's going to go to anyhow? Well, people don't do that anymore. They push that chocolate cake away. They go to the gym. They start working out.
The investment they've made in the liposuction?
No, it's because their whole life changes. They feel better. They look better. They look in the mirror. They really see that better body. They really see the way that they're doing, and they get better. You know, they're better in their lives. They're better with their spouses. They're better in their jobs. It's a whole different change of perspective.
So what is the age range, by the way, of people that are coming in for body contouring, liposuction? What do you call it, by the way? I mean, what do you call it?
I call it body sculpture. I really like to call it body sculpture. People still know the term liposuction, so it's referred to as liposuction, but I prefer to call it body sculpture because that's really what we're doing. Now, what is the age range? Well, I think it's any place from the age of 18 to 75.
You've had a 75-year-old?
I had a 75-year-old. Her name was Amelia.
Is that appropriate, though? Is that appropriate?
Oh, well, let me tell you about Amelia. She had lived her whole life. She had outlived 3 of her husbands. And she came to me and said, Dr. Lycka, could you help me? And I said, you know, you are a little old. And she said, you know, I've outlived 3 of my husbands. It's time for me, she said. It's time for me to look. And I said,
what areas of her body, though?
It was her abdomen and her sides. And she said, you know, I don't want to look 20 again. That's beyond me, she said. I want to look good in my gowns. When I go to those charity bazaars, when I go to those charity events, I want to look good. This is about me now. I want to feel like I really feel. I want to look as good as I feel. And we were able to accomplish that. And she was just so thrilled. It was beyond belief. She was one of our happiest patients at the age of 75. You know, Randy, liposuction isn't really for everybody. It really is for most people that want to look better and feel better. It's for the lady that has a little bit on her waist that she doesn't look good after her baby and wants to look a little bit better. It's for the guy who goes to the gym who has a chest that he's afraid to take off his shirt in the gym. And he feels that people are making fun of him. You know, he can't wear a tight shirt because he's got these male breasts, or moobs as they call them in the year 2012.
Do the patients call them that sometimes?
They call them moobs now in 2012, and they bother them to no end.
All right.
Well, hopefully we can show you an example about that in a few minutes.
Sure.
And just go over what we did. But the important thing is it's not for everybody. I want to emphasize that. I probably say no to more people than I say yes to in the year 2012. I tell them, look, you know, you're really overweight. You're gaining weight now. If we take this off this area, it's going to go to another area. But right now, I'm going to make a deal with you. If you can lose 20 pounds and come back and see me, I would gladly talk to you and see what we could do to make this body better for you. This is a goal for you. Come back and see me. Let's talk then.
So you describe, very interesting, that you're giving them a younger body. Elaborate on that.
You know, we basically roll back the clock on people. We give them a body like, let's say they're 40, right? Let's say they're 40. We can give them a body that maybe a person looks like in their late 20s, that they've got a body that they just look better in and they feel more comfortable. Now picture what that does for their headspace. Picture what that does for a guy when he's going into a business situation and has to sink that deal. He feels like he's the king of the jungle. He feels like he's the lead lion. He feels like he's the guy that's going to go in there and cinch that deal. but also picture how he is with the opposite sex and how he feels with his partner and how he feels so much more comfortable and so much confident. Picture how he feels at the gym where he can take off his shirt for the first time in his life, and he hasn't been able to do that for years.
By the way, do people tend to get cosmetic procedures, whether it's a face, because you do a lot of facial stuff, on occasions, 10-year reunion, wedding, whatever? Breakup of a marriage?
There's so many life events that trigger people to get cosmetic surgery. I can't go over them. But breakup of a marriage, for example, is a very, very common event that people have. And a person feels like they're going to go back into the marketplace. They got to look better for the younger people out there. And so, but people are losing their jobs in this economy. People are having a hard time.
Why get liposuction?
The answer is because they feel better about themselves. And this economy is not a bad economy. It's an economy of lack of confidence. It's an economy where people have lost their ability to be confident.
Do you look at it as an investment in yourself?
This is.
Do you?
This is the ultimate investment in yourself. You can put your money in a term deposit at the bank for how much? 1-2%? Well, this is something that pays dividends year after year after year. Because how you feel about yourself. What's a better investment than yourself? I don't know of any better investment than yourself. So this is truly.
You believe this. You know what I like about this is you actually believe this. I mean, you live this, like you say.
Well,
you get up and you love
when I started doing this, I didn't believe this at all. But it was my patients that taught me this. It's funny how we start off. When I started liposuction, I was really hesitant about it. But I became very good at it, and I love doing it. And I think it's the things where you have passion that you become good at. I think that's true of everything in life.
You meet other doctors, though, that don't like it. Because I've interviewed hundreds and hundreds of doctors that say, Randy, I don't want to be stuck doing lipo all day. I don't want to come on your show and talk about liposuction.
One of my teachers, one of the guys who taught me way back in the 1980s about liposuction, I phoned him the other day to talk about liposuction, and he said, Barry, I'm not doing liposuction anymore. And I looked at him, I said, what are you doing? He said, I'm not doing it anymore. I said, why? He said, because I hate it. I hate it. I couldn't get up in the morning and do a case. It was the same thing over and over. I said, well, it's not the same case. You're doing something beautiful for people.
He lost his passion.
He lost his passion. And the worst thing in the world is when a doctor loses his passion. That's when he needs to retire or do something else.
Let's talk about the different parts of the body that you're doing. From, I don't know, from the neck, we'll go down.
Sure.
What are the common places you're doing lipo?
In this day and age, almost any area of the body can be done. But let's start from the top and work our way down. One of the things I find that one of the most areas that people get the best results are on a neck. A neck that's hanging there a little bit, a neck with loose skin, a neck that makes a person look so much older. They have the double chin, they have the jowls that flap in the breeze. They just don't like the way they look. And many of these people look in the mirror and they say, geez, I look like my mother or my grandmother. I don't want to look that way. I want to look like me. And it's so unfair.
And that's a short procedure, right? When you do the neck, I mean, it's not. It doesn't take you a long time, right?
It doesn't take a long time, but I have to pay attention to more details there than ever, because this is something that's going to be showing to everybody every day. I have to pay attention to the details even more than any other part of the body. This is an area.
So necks are great. Necks are great.
Necks are great, but you can't make a mistake. Never make a mistake on a neck because it'll come back to haunt you. A neck does make you look younger. It makes you look healthier. It makes you look fitter. It makes you look like you've lost 10 or 15 pounds. It makes you look more vibrant. And at the same time, it makes you look more sexy.
Okay.
It makes you look just that much better.
What about arms? How well do they treat?
Arms are one of the hardest areas to treat, but they're also one of the things that bother people the most. They can't wear sleeveless shirts. They can't wear low-cut blouses. They can't wear low-cut this. I've had women that come to me and say, I won't go to a charity event because I don't want to show my arms. And it's expected of me to wear something a little lower and a little slinkier in that event. And they just hate those arms. They just hate them more than anything else. But they're hard to do. And that's why doctors tend to shy away from them, because it really takes you have to pay attention to the details.
Let's take a look. I mean, you brought some photos.
Okay, let me show you some arms. I love doing arms, as you know, Randy. Arms are something to me. Now, this lady has an arm that is just terrible. What does it look like? She looks like she has her wings. Oprah calls these her wings. Why? Because they look like a sail just sitting out there. Now, a person can't get into a tight shirt. They can't get into a blouse with us. That's the arm that was done afterwards. Look at what's happened there. That sail is gone. Look how much better that arm is. So, you know, arms are really difficult to do, and we really try to sculpt them. And they really make a huge difference with that. You know, that takes the effect of gravity off. The gravity is no longer pulling down these arms, so a person could hold up their arms proudly. But you know, in a person that's really fit, we can really sculpture out a triceps and really make it look that much better. Right. We can make a person so much happier about themselves, it's unbelievable.
Because there's a lot of people, by the way, that are thin, but they just have, I guess, parts of their body, like the arms or saddlebags or whatever, that no matter, you know, how much exercise, whatever.
You know, genetics is a very funny sense of humor, because what it does is put weight on certain areas, puts different deposits in certain areas. And you know, you can tell families of people where the mother and father and even the child all have the same defect, and we can really change that for people.
You have a special technique. I'm calling it a special technique. You described it on the phone for arms.
You know, we really pay attention to the details. We really do circumferential liposuction, where we target that area. We fan out the area. We literally use the smallest cannulas and go into that area.
Cannula are the little instruments?
The little tubes that go in and literally grasp out the fat. They literally just shape the area. We literally shape that area over and over and over. We work that area until it's smooth as a baby's bottom, so to speak.
So you go all the way around?
Absolutely.
So what about the downtime for arms, for example?
You know, that's the amazing thing. I've done arms for people, and they get them done on a Thursday or Friday and are back at work by Monday, Tuesday.
But are there those that, even though you tell them not to, they go to work the next day?
I have had people go and golf 18 holes the next day. I've had people go to work the next day. I've had people go back to work the same day. Now, I don't want them to do that, and I say, please don't do that. But many people, you know, in this day and age as workaholics, they've done it. But the point is, arms really do well. People do well. I always tell people after a procedure that they should let their body tell them what they can do. Okay. They shouldn't push the edge of the envelope, but if they want to go to the gym next day and do some light exercises, that's okay.
Bra strap area, moving down. I'm surprised to hear that that's an area that you do.
You know, the bra strap area on the back, yeah. You know, many women, when they put on their bra, they call these areas their third and fourth boobs back there. And they just hate that area. It's an area that they have the highest degree of dissatisfaction with. They just hate that area more than anything else. Now, how does that work? Well, you know, they just don't feel good in their clothes. They don't feel good naked. They feel that that area is really bothering them, and they really want to get that area off. Now, once we take that area off, we flatten it out. And these women change. They can wear those tight blouses that they couldn't wear for a long time. They can wear that tight, slinky outfit. They can look so sexy. And the word sexy is a very important term here for them. They feel so much better about themselves.
Okay, good. Now, photos. You brought some photos. What are we looking at here?
Now, let me just go through this a little bit, and I'll show you a chest to begin with of a male, and this is one thing that I'm very proud of. But please be aware that most of my patients are women. For every man I do,
a lot of women photos.
We do, and if we have time, we'll go through those.
Okay, yeah,
but we'll go through this. Now, this fellow came in, and he really hated his chest. He really hated what was going on there. He couldn't wear a tight shirt. He would never take his shirt off in public. Now look at the side view, Randy. The thing about this is...
Not so bad, by the way. I mean, that's a pretty good chest.
Oh, come on, Randy. He hated this. He really hated this chest. This drove him crazy. What we did right here, Randy, is we basically took that chest, we flattened it out. We fanned out that area. We took out every little lobule of fat. We really sculptured that chest to the way he wanted it. We took that chest, and he felt so much better about himself. He felt so much more comfortable.
Let me see the after.
Let me just show you that, just like that. Look how flat he was. Look how different he was. Now this guy can now all of a sudden wear that tight shirt.
Let me see the front view.
He felt so much more comfortable.
Oh my.
This chest was perfect for him. I want you to look at the before and I want you to look at the after. He looked so much better. Now there was an added side effect with that. What happened is he started to eat better. He started to take care of himself. He started to go back to the gym 3-4 times a week. He started to look better, feel better. And you know, he got a promotion at work. He had a young girlfriend, and he was very happy with that. His life changed. He was a totally different person.
Okay, good, good.
Now we have another man here. He really didn't like his abdomen.
Pretty
he
fit,
didn't like the way he looked.
Fit.
You know, he's pretty fit, but again, he didn't like it. He didn't like the way he looked. Again, he wouldn't take off his shirt. But this was really affecting him psychologically more than anything else. Okay, so look at the after. Look how we sculptured his abdomen. If you look carefully here, you can see some definition of his abdominal muscles. There might not be a six-pack here. care, but it certainly is a 4-pack, and he's happy. Now this guy's life changed again. He started working out more, he started eating better, he started taking care of himself better. He was able to push away the desserts, he was able to go to the gym more, he was able to feel that much better
now
about
with
himself.
women, the biggest area, the most popular area is what?
There are 2 areas on women that we do, abdomen and sides and thighs. And those are the areas that people hate the most.
And how well do the thighs treat?
Thighs are amazing. We could really sculpture people new legs. This really does something that's amazing.
I mean, the ones that
for
rub
people.
together, for example. I mean, do you hit the in area?
You know, one of my patients once asked me, and she was my neighbor at the lake, we have a cabin at a lake, and she said, you know, the thing that would make me the happiest is that wind would whistle through my legs. And sure enough, the wind would whistle through her legs, and she was thrilled. Her legs were so beautiful afterwards. She could wear those shorts that she couldn't before. She could wear that short dress that she could wear before.
Are you going all the way around the legs?
Absolutely. You know, we try
Why
to do
some doctors tell me, by the way, over here in the U.S., that, you know, Randy, the thighs are tricky, you got to be careful.
You know, that goes back to the dark ages of medicine when we used to do it under general anesthesia and people used to bleed a lot during those procedures. Now we get no bleeding, so we could really sculpture
or very
those
little
areas.
bleeding, we should say.
I say no because in the average procedure we lose 10 cc's of blood, which is so little, it's practically non-existent. Right. So although I say no, it's very little, if you want to be technically correct. But it's amazing what we can do with that.
What about the saddlebag area?
The saddlebag area is an area that we get the highest degree of satisfaction. People that would come in with regular thin waists before would have big saddlebags. And we could really take those saddlebags and make them so much better. We could really sculpture them to the point that these thighs are gorgeous.
Knowing you were coming in, you know, I know somebody, runner. She goes, and she thinks that she's got these saddlebags, which, you know, I don't even notice, but there are certain people that are killing themselves with exercise, and they've got this one little part of the body, whether it's arms or saddlebags or whatever. I mean, do you see a lot of that?
I see a lot of that, and in fact, they're doing a big mistake. They're exercising, which is making the muscle bigger, which is pushing the fat out more. So it's actually making the area more dominant. It was making the area uglier. So they really need to think about seeing a cosmetic.
Is saddlebags easy for you to do?
The answer is
all the areas?
We do them, and again, as long as you pay attention to the details, it's an easy area to do. But all this is paying attention to the details. Nothing's easy in all this, but you have to really be a fanatic. You really have to pay
You're a
attention.
fanatic about this? Are you a perfectionist? Do people call you a perfectionist?
Yes, I am very much a perfectionist when I do this. It's something that I love to do, and it's something we bring out the best of people. So it's something I really am proud of.
So the mommy makeover crowd, or women after pregnancy, lipo,
Yes.
is that, what do you say to these women?
You know, I think it's a very nice area for people to work on. Many women who go through pregnancy have bodies that have changed a little bit. Many women take care of themselves in pregnancies now, so they don't gain a lot of weight, but they have certain areas that just don't respond after pregnancy. It's funny how the body changes and just won't go back no matter how much they diet, no matter how much they exercise. They just can't take it away.
And you can do knees?
We can do knees.
I mean, is that a common procedure or rare? Would you like to see more knees?
Anytime I do this, Randy, I love to do the knees. Anytime I do the thighs, I do the knees as
really?
well. Because otherwise a person looks knock-kneed, and no one wants to look knock-kneed. It's an area that we do a great deal of. Something that really we pay attention to, and people get great, beautiful knees. They can wear short skirts again, which is something they couldn't before.
Is the perception that all doctors are doing liposuction the same way?
The answer is I wish they were, but nobody does liposuction the same way.
And there's a lot of technology, though. I mean, we're talking about laser, we're talking about radio frequency. So for people just tuning in, we're talking about liposuction, one of the busiest doctors in all of Canada, almost all the world. I mean, if you're doing 200 or 300 procedures, liposuction a year, you're probably one of the busiest guys in the world. It's fair to say, okay?
Humbly, yes,
and like
I think
you say,
so.
Your best case was your last case. I like that line. But technology, because it's all about getting smooth results.
Let me tell you a little bit about
it.
technology.
Yeah.
Technology helps us, but it's not the be-all and end-all. You really have to be an artist to make things better. You know, a laser will help, but unless you know how to use that laser properly, you won't do very well with it. It's like everybody can buy a paintbrush, but not everybody's a Michelangelo. I'd sooner be a Michelangelo than a Picasso. You know, you really got to be better at these things, and that's what it's all about.
Now, what about, I talked to a guy doing facelifts, and he said, Randy, it's like golf. You become rusty if you don't do it all the time. Is it the same way with liposuction?
Absolutely, absolutely. I know when I take 2 weeks off for a vacation that I'm not quite as good as I was when I came back.
You get out of the rhythm
but
of
I get out of the rhythm of it. I just, but I get back into it very rapidly. I have a ritual that I usually do, and that puts me back in. But it's something you have to do, and you have to do it over and over and over again. But you pay attention to the details, but you got to pay attention to each individual, because every individual is different. Everybody has their own nuances.
What are the, and we're out of time. What are the questions they ask on every consult?
They're afraid. They're always afraid about what's going to happen. They're afraid of their results. They're afraid of what's going to go on. They're afraid of pain. They're afraid of suffering. They're afraid of downtime. They're afraid of just change. So those are questions I get all the time. And I always tell my patient one thing. I say, let me do the worrying for you. I know what to worry about.
Good, good. Okay, so all of this is on your website, because there's a lot of graphic photos we cannot show on this. And you're not afraid to take on the larger patient.
No,
is that right?
I love the larger patient. This is not for every larger patient. They have to make a commitment to change. But we can do things for larger patients that we couldn't do for other patients. And many of those patients are our happiest patients, because they can go down a couple of sizes in clothes, they can feel better about themselves, and that really makes all the difference. Okay,
great. Final message. Somebody watching this, maybe they just don't like these certain areas of their body. What do you say to them? And they don't know what to do.
I'd say come on in and chat with us. I'd love to talk to you a little bit about this. Let's see what bothers you and see what we can explore. See what we can do about this. I really want to get to know that patient and see what their goals are and see what they'd like to achieve. This is about goals. This is about how they want to be perceived. This is about where they want to be and about happiness and where they want to be happy.
Good. I want to thank you for coming on the show. Good, great info.
Randy, thank you so much. It really is my pleasure.
You've been watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you'd like to see this interview again online or direct a friend to it, you go to wellnesshour.com. We're going to have it there. Also, hashtag on Twitter, The Wellness Hour, if you want to make a comment about Dr. Lycka. For now, I wish you good health.